So today's learning objectives are, by the end of this lecture, participants will be able to understand common causes of reagent shortages in the laboratory and how to manage supply chain disruptions. They will be able to learn how digital inventory systems improve resource tracking and reduce wastage, identify sustainable procurement practices that enhance laboratory cost effectiveness, also recognize how inventory and procurement align with ISO 15189 2022 requirements. Question 1. Why is supplier diversification important in laboratory procurement? Option A, it reduces the number of invoices generated. Actually, this is a pre-webinar questionnaire, pre-test questionnaire. Okay, we will go through this question, and after the whole discussion, we'll be able to know if we can be able to answer this question. But listen, why is supply diversification important in laboratory procurement? A, it reduces the number of invoices generated. It increases dependence on global markets. It minimizes the impact of disruptions from a single supplier. It lowers the quality of laboratory materials. Which of the following is not a common root cause of reagent shortages in laboratory settings? A, over-reliance on a single supplier, effective inventory forecasting, importation delays and customs issues, global supply chain bottlenecks. Then the last but not the least question, what strategy is most appropriate for mitigating the risk of critical reagent stockouts? A, placing bulk orders annually regardless of usage trends, engaging in pooled procurement schemes with other laboratories, limiting communication with suppliers to reduce pressure, depending solely on emergency revisions during shortages. All right, so let's move on. Introduction. Well, I will start by saying that efficient supply chain inventory and procurement management forms the backbone of reliable and responsive laboratory operations. In fact, it is a critical and essential component of the laboratory quality management system. From reagents and consumables to critical diagnostic equipment and the uninterrupted availability of supplies directly influences a laboratory's capacity to deliver timely, accurate, and quality assured results. The importance of this procurement and inventory control is reinforced by international standards like the ISO 15189 2022 and the WHO laboratory quality management systems. They are the frameworks that emphasize the integration of procurement and inventory control into the broader laboratory quality management system. Especially ISO, it has introduced the more robust requirements for supply chain planning, including the evaluation of suppliers, the documentation of procurement processes, contingency planning, and the assurance of traceability of critical materials. These frameworks, that is the ISO 15189 2022 and the WHO laboratory quality management system, they emphasize integrating supply chain processes into the overall QMS by adopting a risk-based approach to supply management. Why optimize supply chain and inventory inventory and procurement, why is it necessary that supply chain should be optimized, as well as the inventory and procurement processes? ISO strengthens requirements for supplier evaluation, procurement documentation, and contingency plans and traceability. Poor supply management leads to stockouts, expired reagents, financial loss, even reagents waste. These issues affect the quality of the test results, they delay the diagnosis, and risk patient safety. Optimization, therefore, is a strategic necessity for a reliable, compliant, and sustainable lab operation. Now, let's discuss the interrelationship between these key elements. That is the procurement, inventory control, and the supply chain management. Procurement initiates the cycle by sourcing quality reagents, equipment, supplies through vetted suppliers, making sure that these are that cost effectiveness, compliance, and reliability are achieved. Inventory control maintains optimal stock levels. It ensures that usages are tracked. It prevents wastage and supports uninterrupted testing. While supply management ensures timely delivery, mitigates disruptions, and maintains traceability of materials from supplier to the lab bench. So if you look at this diagram, you see how they are interrelated. Management of reagent shortages and mitigating supply chain disruptions. It is important that laboratories don't run short of reagents, because when laboratories run short of reagents, it disrupts the activities of the lab, compromise quality and patient care. To effectively address this challenge, it is very important to understand the underlying causes, actually the things that can lead to reagent shortages and supply chain disruptions. And remember the lecture we had the last time on risk-based approach to process optimization. During the lecture, we mentioned use of root cause analysis, and that is the same root cause analysis that you will apply in understanding why or what leads to reagent shortages in the laboratory. So the root causes of reagent shortages in the lab could be global and local supply chain bottlenecks, such as delays in international shipping, manufacturer backlogs. They have a lot of backlogs of supply of manufacturing to make. Okay, so such that they do not meet up, and it can lead to reagent shortages in the lab. Regional conflicts, when there is maybe unrest in a particular region that produce a particular type of reagent, or maybe they have a monopoly in production, it can lead to shortages of these reagents. These often cause unpredictable stockouts. During global health emergencies as well, there can be reagent shortages because the demand at that time is, in fact, it can surpass the supply. Okay. Then limited production capacity for one reason or the other can also lead to global and local supply chain bottlenecks. Then another root cause of reagent shortages are over-reliance on single suppliers or geographical regions, whereby, like I've mentioned before, some people now gain monopoly of manufacturing or being the sole suppliers of particular reagents and machine. A typical example, I will use in our environment is like maybe the apheresis machine. Okay, in Nigeria, there's a company that, in fact, there are a few people that have sole monopoly of not just supplying the machine, but also providing the kits, supplying the kits needed for the machine. Okay, so it leads to shortages in the available of these consumables. Then importation delays, custom issues, and regulatory barriers can also be a root cause of reagent shortage. This is very common in many low and middle income countries, whereby you experience lengthy clearance procedures, uncoordinated documentation requirements, and fluctuating foreign exchange policies, which can all contribute to procurement inefficiencies. Then another root cause could be poor forecasting and inventory control. If this happens within laboratories, it can result in reactive ordering, leading to either overstocking and wastage or delayed replenishment and service, which will eventually culminate in service interruptions. Let's look at risk-based supply chain mapping and analysis. This is a structured risk-based approach to supply chain management, which allows laboratories to anticipate potential disruptions before they happen and develop strategies for resilience and prevention. What are the strategies for risk-based supply chain mapping and analysis? Number one, categorizing supplies based on criticality to laboratory functions. Here, it begins with making sure that essential reagents, that is those that are required for either blood grouping, depending on how you categorize them in the order of how critically they will be needed in the laboratory. For example, you can say that, oh, those needed for blood grouping, infectious disease screening, or cancer diagnostics should be prioritized in procurement and buffer planning. Another one is mapping supply chain vulnerabilities, and development of alternative pathways. Here you can identify potential failure points in sourcing, transportation, storage, and supplier reliability. This will enable the development of alternative pathways. Now you begin to look for alternative pathways in those areas that you're experiencing challenges in the supply chain. And also when you now look at these other options and see if by using those other options you could maintain your service and ensure the continuity of service without interruption. Then developing risk registers is another way of risk-based supply chain mapping and analysis. Okay, you create risk registers and mitigation plans, which will ensure that potential threats are documented. Remember that risk-based approach at any point in the laboratory quality management system is all about proactiveness. It's all about detecting the risk, okay, possible risk or possible things that can lead to a failure in the system, and being proactive against it and trying to do something before it actually happens. So these registers support strategic decision making. They facilitate regular review and also go ahead to inform policy adjustments in the procurement and inventory planning. If you look at the diagram here, You will see the types of supply chain risk, such as quality, time lead, could be reputational, could be environmental, it could be human. Okay, it could be as a result of human error. It could be technological, it could be legal, and it could be economic, it could be geopolitical. Implementing risk-based supply chain mapping analysis. This is a kind of step-by-step guide on how to implement risk-based supply chain mapping and analysis in the laboratory. It doesn't matter the area of the laboratory, okay? This can be applied. So number one is to define your objectives and scope. What is the objective of your risk-based supply chain mapping, and what scope do you want to cover? You can identify, you can go ahead and this involves identifying the goal. Example, the goal could be to improve reagent availability. Compliance, it could also be compliance with ISO 15189. Here, you will just determine which supplies, services, or processes will be mapped. That is what defining objectives and scope is all about. Then you can go ahead to identify key supplies and suppliers. Here, you will list all critical reagents, consumables, and equipments. You can document associated suppliers with these critical consumables and equipments. You can include intermediaries and even consider alternate vendors. Then you can go ahead and map the supply chain. You can achieve this by creating a visual flow diagram showing each stage of the supply chain from the point of sourcing to the point of use. You can include supplier locations, transport routes, warehousing, and internal distribution. The next is to assess risk at each node. Having succeeded in mapping the supply chain, the next thing is now to assess the risk, possible risk. Remember that risk-based supply chain is all about being proactive, even before the risk happens. So you evaluate the risks such as supplier reliability, transport delays, single source dependencies. Remember I mentioned monopoly earlier. Okay, so what are those reagents and consumables and equipments in the supply chain that are from a single source, quality failures, etc. You can use tools like FMEA, which we discussed the last time, okay, failure mode effects analysis, or you can use a risk matrix. You can also, the next is to categorize and prioritize the risk. Now you have assessed the risk at each node. Okay, it makes sense to start from those of higher priority. So you prioritize them. You classify them by likelihood and impact. Okay, example, low, medium, or high. You can highlight critical points where a disruption will severely affect operations. Then you can go ahead. The next step is to develop mitigation strategies. By establishing contingency plans. Example, okay, such as buffer stocks, dual sourcing. These are contingency plans you will develop. Buffer stock is all about the stock you have available to make sure that whatever it is, the reagent, the consumable does not finish completely. Okay, is not all used up. Okay, so it is that stock that you hold on to, so that on up until the next purchase is successfully made. Then dual sourcing, emergency procurement protocols. We will still discuss that further as we go on. Then others are strengthening supplier agreements. These are the mitigation strategies you can use in this risk-based supply chain mapping to ensure that you don't run out of reagents or stock. You strengthen the supplier agreements and include performance and expectations. The last but not the least is monitoring and reviewing. Okay, you achieve this by implementing key performance indicators, KPIs, to monitor supply reliability and risk. Then you can now go ahead, review and update the risk map. You already have it. So you, after some time, from time to time, you go ahead, update regularly, review, and even it can even be done after disruptions. You can just go back, look at where the disruptions is from, and still update, review and update. Thank you. Sorry about that again for the interruption. Okay, the next mitigation strategy is proactive communication with suppliers. This is key for early warning of potential shortages or changes in availability. Long-term partnerships with suppliers can improve forecast accuracy, can enable you to forecast accurately. And also reduce lead times. Another one is demand forecasting tools and historical data analytics. This can be used to identify usage patterns, anticipate needs, and automate reorder levels, especially when integrated with a digital inventory system. Lastly, diversifying suppliers and sourcing locally when feasible is another mitigation strategy which can reduce dependence on imports and strengthen the local supply ecosystem, thereby encouraging local manufacturers, especially for basic consumables that that should be readily available locally, and this can be a sustainable long-term strategy. Okay, let's look at emergency preparedness and business continuity planning. In line with the risk-based thinking, laboratories must establish a formal plan to manage unexpected supply disruptions. Such plans are creating contingency plans for essential reagents and consumables. These contingency plans should be able to identify essential reagents and alternative testing protocols, like I've mentioned before, that can be used during emergencies. These plans must be reviewed periodically and integrated into the laboratory's QMS. Stock rotation and inventory cycling. All right. So the last but not the least mitigation strategy is diversifying suppliers and sourcing locally when it is feasible. This will reduce the dependence on imports and strengthen the local supply ecosystem. Emergency preparedness. Okay, I was at emergency preparedness. Now, in line with the risk-based thinking, laboratories should establish formal plans to manage unexpected supply disruptions. Such plans are to create a contingency plan for essential reagents and consumables, which I've explained before, to stock rotation and inventory cycling, to do stock rotation and inventory cycling to prevent expiration, and also to set up an internal SOPs for emergency requisitions and substitutions. These are essential practices to prevent expiration and to ensure freshness of reagents, especially those with short shelf life. lives. Labs should develop internal SOPs for these emergency requisitions and substitutions. These SOPs should detail escalation protocols, decision-making authorities, and documentation requirements during scenarios of crisis. Okay, this is a diagram detailing the business continuity plans and disaster recovery plan. Under the business continuity plan, you have the business management procedures, business continuity strategy, and risk assessments, which will all lead to the successful development of an emergency, a disaster recovery plan, which will culminate into emergency management procedures. What are the emphases of ISO 15189 2022 on this? It's on mitigation strategies. It explicitly reinforces the need for a robust and risk-based approach to supply chain and inventory management. It requires that laboratories should identify risks that could lead to quality compromise or compromise in the continuity of service, and also to establish documented contingency plans for critical supplies and services. This will include both routine and emergency procurement procedures. Sorry once again for the technical hitch. Okay, let's continue. I noticed that my slides were not moving, even though I was moving my slide. Okay, I stopped at business continuity. Okay, business continuity plan and disaster recovery plan. Done with that. So I was at the emphasis of ISO 15189 2022. Okay, it explicitly reinforces the need for a robust and risk-based approach to supply chain and inventory management. It also requires that laboratories should identify risks that could compromise quality and continuity of service, and also to establish documented contingency plans, which we have discussed before, for critical supplies and services. This will include that for both routine and emergency procurement procedures. The standard also emphasizes engaging with competent suppliers, those who have over time demonstrated adherence. Can you hear me? Those who demonstrate adherence to quality systems and have a proven track record of reliability. Through these requirements, ISO 15189-2022 aims to ensure that labs maintain uninterrupted services and uphold patient safety, even in the face of supply chain challenges. Okay, let's look at a case study on management of reagent shortages and mitigation of supply chain disruptions. Okay, this scenario is about a tertiary hospital lab experiencing a week-long delay in diagnosing tuberculosis due to a shortage of Genestat cartridges. The delay led to treatment deferrals and increased risk of community transmission. Now, the questions are, what proactive steps could have averted this? And what steps can be taken to avoid a recurrence? Discussion. If this lab had conducted a risk-based supply chain analysis, well, gene expert cartridges would have been identified as a critical supply and as critical. Okay. A buffer stock policy, remember I mentioned and explained what buffer stock is. A buffer stock policy and a contingency plan, such as having an alternative procurement or means or a supplier through a pooled procurement group or emergency allocation from another lab could have averted the disruption. Regular engagement with the supplier and integration of a digital inventory tracking would also have flagged the impending shortage early, allowing timely intervention. Now, let's look at implementing digital inventory tracking for efficient resource utilization. What are the challenges? Because yes, most labs, especially in low middle income countries, use the traditional paper-based inventory. Okay, and it is not without challenges. What are the challenges of a paper-based inventory? It is prone to human error. Example: incorrect stock counts, missed entries, and all of that. It's associated with delayed updates and lack of real-time visibility, leading to poor decision making. Has limited traceability because when you are doing that, okay, it might be you're using a register and you're done with that register and you put it away and you bring another one. When there is need for you to trace back to go back to your records, you may start looking for the register again to refer and all of that. So it limits traceability. But if it is a digital inventory management, everything you see everything in real time. So it limits traceability, thereby making audits and investigations more difficult. It can lead to inconsistent record keeping. Remember the human factor. Sometimes people record, sometimes they forget to. Okay, so it can cause stocking and the benefits of a digital inventory management. It encourages real-time tracking of stock levels. You see the expiry dates. Once you've entered this information of a particular supply, it's there and you see it in real time. You can call it up whenever you need it. Okay, and also it can show you the usage patterns. You see the usage pattern real time. You know the number, the quantity you keyed in into the digital inventory, and when it is talking out, you see it in real time. There can even be an alarm system in place to alert you when you are running out of stocks. It enhances transparency and accountability across the departments. Automated alerts, like I've mentioned before, for reordering, low stock, or approaching expiries is available in the digital inventory management system. It also facilitates data-driven forecasting for procurement and budgeting. Since you're seeing everything in real time, it is data-driven. You know when to forecast, when you're looking at for the reagent to finish, you know when you're going to run out of stock, and you'll be proactive about your procurement and even budgeting for the reagents, consumables, supplies generally in future. It also improves compliance with ISO 15189-2022, particularly in traceability and documentation. What are the impacts of digital systems? They enhance laboratory accountability and resource optimization by empowering labs to implement effective mechanisms such as user roles and access controls. So the advantage of this digital system is that it enables the lab to assign user specific permissions, and this engenders accountability and prevents unauthorized inventory actions. It can also help in tracking waste and usage patterns. These digital logs help to identify wastage, monitor usage trends, and support corrective actions. It can link inventory to operational outputs. thereby connecting stock data to test volumes. Okay, you know the number of tests you do in the lab every week, every month. You can, using a digital inventory system, can connect these two, the stock data, the amount of stock, the quantity of stock you have to the usage volumes, and this enables efficient resource planning and justification. So what is the ISO 15189-2022 emphasis on digital inventory management system? Now, one of them is traceability and real-time tracking. It requires that labs should maintain a full traceability of their reagents and materials from the point of procurement to disposal, ensuring that there is accountability and quality control. Then another one is stock management procedures. The standard mandates defined procedures for stock monitoring and also replenishment to prevent shortages and also maintain uninterrupted testing. So all these things should be in place. Okay, and that is the emphasis the ISO 15189 is laying on digital inventory management. Also, digital tools for accuracy and efficiency. They are emphasizing that digital tools should be used, and this supports the adoption of digital systems to reduce manual errors, okay, human errors. It can also help in streamlining inventory workflows and also enhance overall operational reliability. So when you look at this diagram, this is an example of, an interface, a computer interface, a digital interface of laboratory stock controller. Okay, see the stock inventory, suppliers, the categories, location, unit codes, and all of that. Even the manufacturer, what are the stock types? Okay, so it makes inventory easier and seamless. Now let's look at this case scenario of an inventory waste due to overstocking. A diagnostic lab frequently over-orders reagents, resulting in excessive stock that often expires before use. This led to this leads to financial losses in the lab, inefficient use of storage space, and increased biohazard disposal costs. So the key problems or the key challenge here is that there is a lack of real-time inventory data and usage tracking, which is preventing informed procurement decisions. Now, the guiding question here is, how can a digital inventory system help prevent over-ordering and reduce wastage? Number one, by automated alerts, which will notify the users when stock is nearly expiring or when levels exceed defined limits, helping to avoid unnecessary reordering. Okay, but if it's the traditional record-based, paper-based method. Okay. Yes, it may be in one register, but you may not notice it. But you see everything in real time when you're using a digital inventory system. Consumption analytics, which tracks usage trends over time, and this allows for data-driven forecasting and more accurate procurement planning. Reorder thresholds. The system define minimum and maximum levels trigger orders only when needed, preventing both under and overstocking. Okay, so when the there's here you have a minimum and maximum level order levels, which can trigger the need for ordering when it's under. Okay, and also tell you when you're overstocked so that you don't need to go and make orders. Audit trails maintains a log of all inventory actions. Example, additions, removals, adjustments, okay, to ensure accountability and identify misuse or mismanagement. So you know what happened to the stock. Okay, you know when there is a removal, you know when more is added, you know when other adjustments are made, just to make for accountability. Let's look at sustainable procurement strategies for laboratory cost effectiveness and reliability. in modern lab management, the procurement process is not just about um, a logistical function, but also it is a strategic tool for achieving both operational excellence and environmental responsibility. We'll still discuss that further. I will expand on what I mean by environmental responsibility. With rising costs, there are stricter regulations and global commitments to sustainability. So laboratories must evolve their procurement approaches to support long-term viability, reliability, and compliance. Now let's look at the principles of green and sustainable procurement. Green and sustainable procurement is all about making purchasing decisions that consider not just the cost and quality, but also environmental, social, and ethical impacts. This requires that laboratories should shift from traditional short term purchasing to a more holistic life cycle based approach. It's not just about, okay, I need this quantity. Okay, let me just purchase it because I have the funds to purchase this amount. And you've not considered whether on the long run, is it the most cost effective approach? Is it the most environmentally safe approach? Is it so the third life cycle based approach is by reducing packaging and promoting reusables. Labs can significantly reduce waste by selecting products with minimal or biodegradable packaging. For example, refillable containers for chemicals or reagents, reusable sample vials, and recyclable pipette tip boxes are all examples of sustainable alternatives that can reduce operational waste and disposal costs. So if you look at this diagram, you see the sustainable procurement, okay, strategies. You have the environment, you have the society to consider, you have the economic aspect to consider. Okay, when you're considering the environment, you look at the circular resources, carbon positivity, land use, water use. Okay, when you're considering the economy, you're looking at consumer well-being, fair business, then society, healthy community, empowered individuals. Okay, let's look at strategic sourcing and vendor management. Strategic sourcing is the process of planning and managing procurement to make sure that long-term supply reliability, quality assurance, and cost control is achieved. Vendor management plays a very key role in achieving consistent service levels and also facilitating supplier accountability. They can be achieved by approved vendor list with performance monitoring. So here you need to establish a system to vet and regularly review vendors based on criteria such as the quality of their product, reliability, cost effectiveness, and adherence to delivery schedules, and also their compliance with environmental standards, like we've mentioned before. Poor performing vendors can either be removed completely or given corrective action plans. Another one is incorporating quality and delivery benchmarks in contracts. Procurement contracts should be specific about the your expectation of the product standards. For example, are they compliant with ISO? Are they compliant with good manufacturing practice? You should also consider the delivery times, compliance resolution procedures, and also consequences for defaults. This will ensure continuity of operations and reduce downtime. Another another way this can be achieved is by supplier partnerships for innovation and value-added services. Beyond transactional relationships, labs should build partnerships with suppliers that are willing to co-develop customized solutions, because it is the lab's feedback that will enable the suppliers to know, or the manufacturers to know, how to improve on their products. They can also provide training on new products and also provide shared saving incentives for sustainable options. So let's look at the 7 steps of strategic sourcing. Strategic sourcing is a structured approach to procurement that focuses mainly on optimizing supplier performance, reducing costs, and aligning purchasing decisions with the lab's long-term goals. It usually goes beyond just purchasing the products by emphasizing data-driven decision making. And here comes the importance of using a digital inventory management system. Its supplier evaluation and value creation. So the following 7 steps outline a step-by-step process that helps labs to secure reliable, cost-effective, and high-quality supplies, while at the same time managing risk and ensuring compliance. The first is identify spending categories. Okay, what is the spending category of your what are your spending category? What is your budget? Then you do a market research. Then you go ahead sorry, you go ahead and do a supplier market assessment. You assess your suppliers. We've mentioned this before. Then you develop a sourcing strategy. Then you go ahead and select your suppliers and negotiate. After negotiating with your suppliers, you can now go ahead and develop a relationship, what we call them supplier relationship management. It's very important. Okay. Then you review and improve as time goes on. Cost-effective procurement practices. What are the cost-effective procurement practices? Okay. Cost containment is a priority for labs, particularly in settings with limited budgets. It is important that procurement is sustainable, and this does not just mean higher expenses. In fact, it can lead to significant cost saving when it is executed strategically. Such cost-effective practices are bulk purchasing. Okay, so this is all about consolidating procurement for frequently used items, and this will go a long way in helping to leverage volume-based discounts. Okay, when you're purchasing your reagents, consumables in bulk, it will enable you to have a volume-based discount, and also it can also reduce administrative overhead. Framework agreements can secure favorable pricing over time and also minimize repeated tendering processes. Centralized procurement for multi-laboratory networks. Okay, for example, let me use the example of our National Blood Service. Okay, we have a central purchasing system. Okay, it is also a cost effective procurement process. When labs operate like this under a common health system or regional authority, these centralized procurement units can streamline sourcing, they can reduce redundancy and ensure standardization across facilities, so that people don't just do what they things the way they want in their different centers. Everything is centralized. Then this is very useful, especially for public sector labs managing national disease control programs. And also, the typical example I gave you is our National Blood Service Agency here in Nigeria. Then another way of Another way of saving costs is by use of e-procurement platforms and reverse auctions. This is about using online procurement systems to enable wider vendor participation in the procurement in the process. Okay. Here you have better price comparisons and human errors are reduced. And also reverse auction where reverse auction is a situation whereby the suppliers will compete to offer the lowest bid, and this can help drive prices down for high volume consumables and reagents. So these are the cost reduction strategies: supplier negotiations, sourcing value. Okay, it's not just about the cost, immediate costs, about value. Then demand forecasting, saving analysis, e-procurement solutions. I've mentioned it before. Okay, lean management. Remember our last lecture on lean management in process optimization is about reducing your processes down to the most important. Okay, so in procurement, you don't purchase things you don't need in the lab. So that's where lean management comes in. Value analysis, you analyze the value it gives. Supplier relationship management, I've explained that before. And also risk management, you have to be proactive, optimizing contracts, green procurement, we've discussed that, then continuous improvement in your procurement practices. Now let's look at regulatory and quality compliance. Procurement has to align with international and local standards. That's to ensure safety, traceability, and quality of all materials and equipment entering the laboratory workflow. You can achieve this can be achieved by adherence to standards, be it the different standards, could be the ISO 13485, could be the ISO 9001, could be the good manufacturing practice. Okay, the key is to adhere to standards. So all suppliers, in order to achieve this, all suppliers need to provide documentation proving compliance with relevant standards. For instance, a certain ISO or GMP certified supplier should ensure that the quality and safety of they should ensure that the equipment, reagents, consumables, supplies they are giving are of high quality and also safe, that it meets up to the safety standard. While, for example, ISO 9001 will ensure overall quality management in supply chains. Okay, another way of achieving regulatory and quality compliance is by supply chain traceability. Labs should be able to trace every supply item from the ordering to storage to usage, and that is where the digital inventory management system also comes in. It makes it easier. This is very important for product recall situations and also for verifying batch related quality concerns. Okay, for example, if there is in the lab and a test is done for a particular patient and there is a challenge, okay, you should be able to trace back to the reagents, trace back to the suppliers, trace back to the quality standards. So another way to achieve regulatory and quality compliance is by verification of ethical sourcing and supplier certification. Labs should ensure that suppliers they are dealing with comply with ethical labor practices, environmental regulations. Remember what we said about environmental considerations. Then also, they should be the sourcing should be conflict free, particularly for those um, commodities like diagnostic kits, electronic components, or specialized reagents. It is important that to do supplier audits and documentation because this will help validate compliance. Now, what is the emphasis of ISO on quality and regulatory compliance? The updated ISO 15189-2022 standard, which sets requirements for quality and competence in medical labs, includes several new provisions that align with sustainable procurement principles, such as stronger require they require they they are emphasizing that there should be stronger requirements for supplier evaluation and monitoring. That is to say that labs must now demonstrate that suppliers are routinely assessed, not only for quality, but also for compliance with sustainability and ethical sourcing standards. Another one is encouragement of environmental sustainability in procurement. Like we've discussed, labs are now encouraged to integrate environmental sustainability as part of their procurement criteria. This means that they need to be giving preference to products and vendors that reduce carbon footprint, conserve resources, and also support waste reduction. Next is continuous procurement performance review. They are also emphasizing the importance of reviewing procurement performance as part of the broader quality management improvement efforts. Okay. Key performance indicators may include supplier reliability, cost saving achieved, and all of that. So let's look at this case scenario. Your lab wants to reduce its environmental footprint while cutting costs. Discuss how sustainable procurement could meet both goals. In other words, how would sustainable procurement meet the dual goals of reducing environmental footprint and at the same time cutting costs? So let's look at the discussions. Sustainable procurement will enable labs to achieve dual objectives. Number one, cost efficiency, and secondly, environmental responsibility. Okay, without compromising the quality of their services. For example, instead of purchasing single-use plastics, the lab can switch to refillable buffer solutions, reducing both waste and repeated purchase costs. Okay, you don't have to buy the plastics over and over. You don't have to buy the buffer with their containers over and over again. Implementing bulk purchasing agreements for gloves with suppliers and also prepared tips will reduce cost per unit and also will reduce shipping related emissions. By selecting vendors that provide local delivery options, the lab can reduce transportation costs. It can also reduce delivery delays. Then transitioning to equipment with energy saving features, like we've mentioned before, may have a higher upfront cost, but at the end of the day, it will result in long-term savings on electricity bills. Use of digital procurement platforms will minimize paperwork and allow for easier comparison. Like we discussed before, you'll be seeing everything in real time. It will allow you to have an easier comparison of suppliers based on both costs and environmental attributes. By tracking the key performance indicators of procurement, the lab can quantify the financial and environmental benefits of these changes, such as percentage reduction in waste. What is the percentage reduction in waste over time? What is the annual cost savings? And also, they can be able to see the the performance, the improved performance of the vendors over time too. Okay, let's look at integrating supply chain management into the laboratory quality management system. An efficient an efficient laboratory system is supported by a well-structured supply chain integrated into the quality management system. Integrating supply chain management would ensure that lab supplies are number one, they are available, you can trace them, they can be managed appropriately, and they can contribute to patient safety. All these contribute to patient safety, operational efficiency, and regulatory compliance. ISO, it is important to know that ISO 15189-2022 and related standards now place significant emphasis on structured procurement,
This
inventory
like
control,
hi.
supplier management as essential components of quality laboratory management system and laboratory quality. So let's look at the development of policies and SOPs. It is important to establish clear policies and procedures, okay? Because I would like to see it as the first step in institutionalizing supply management process within the lab. That's making all the supply management that we're talking about come to stay in the lab, not just talking about it. So these documents will define how supplies are sourced, managed, utilized, ensuring consistency, accountability, and compliance with quality and ethical standards. Example of such policies and SOPs are procurement policy. It is important to have a procurement policy. This procurement policy is all about outlining the framework for sourcing goods and services ethically and efficiently. That's what it does. It should define approval thresholds. Okay, it should tell you at one point you won't approve for more purchases to be made. Competitive bidding processes is part of it. Preferred vendor requirements, okay, should be in the procurement policy, and conflict of interest safeguards. Ethical sourcing also ensure that supplies are obtained from vendors that comply with labor, environmental, and regulatory standards. I was talking about inventory control SOPs, and I said that it includes step-by-step guidelines on receiving supplies, conducting physical inspection, for damage or discrepancies from the standard. Then also it involves appropriate storage conditions. That is, you need to know it has to contain the appropriate storage conditions for these reagents. Okay, example, the cold chain management, stock issue, stock issuance and reconciliation. Okay. So the SOPs must include measures to ensure FIFO, the first expire, first out practices, or first in, first out practices, as the FIFO, secure handling of hazardous materials and routine stock verification. All these are contents of the inventory control SOPs. Then let's look at another document that is equally important, the emergency procurement and incident response. Labs must have protocols for expedited procurement in situations of emergency, such as stockouts, supply chain disruptions, or public health outbreaks, or even emergencies. This includes predefined emergency vendor contacts. So you should have emergency vendors, their contacts with you, right? Short turnaround approval processes should be in place, okay, so that when there is need, it won't have to go through the bureaucracy of going through different approval stages for the reagent to be purchased, and also documentation templates to ensure transparency and traceability even in those urgent situations. Okay, let's look at the staff training and competence. Is very important as well, because competent staff are critical to maintaining a functional lab supply chain. And also, it is important that training and clearly defined roles should that this staff should be trained, and they should assume clearly defined roles so as to ensure that processes are implemented accurately and consistently. It involves training the staff on inventory systems and SOPs. They must receive regular training on inventory software, because if you're using a digital inventory system and the staff, they don't know how to operate it, it's going to be a very big challenge. They should know how to operate the digital platforms. They should know how to use the manual logs as well. QMS documentation practices is another area the staff should be trained on. They should be trained on procurement policies, and they should be trained on storage procedures. Training the staff on all these will ensure that there is compliance, and also um, it will reduce the frequency of errors in data entry, stock management, and documentation. Another one is designating roles and responsibilities to staffs, such roles you can designate to staff, or examples of roles or responsibilities they can assume is inventory officers. These are the people that oversee the stock levels, they conduct audits, and they flag potential shortages or expiries. Then another role is the role of a storekeeper. The storekeeper manages physical stock handling and ensures correct labeling and placement. He also maintains the inventory logs, whether digitally or manually. Another role or responsibility is the procurement focal points. These are the ones that interface with vendors, that ensure that there is timely ordering and delivering. And they also monitor procurement key performance indicators. These roles may be assigned at both the lab and institutional levels, depending on the size of the organization. Well, coming to competency assessment, there is need for regular evaluation of staff competence, because this will ensure that training objectives are met. Because it's not just training them, retraining them, and leaving them. You have to make sure that by the training they have achieved a level or degree of competence in the training you have given. And also, corrective actions can be taken during competency assessment so that it will, whatever it is, the errors will not repeat itself again. Okay. If deviation, as you're doing competent, what I mean is that as you're doing competency assessment, if you see deviations from the training you have given, you have to employ corrective actions. This will align to with the QMS principles of personnel competence and continuous quality improvement. Let's look at performance monitoring and continuous improvement. Embedding supply chain performance into the QMS allows for data-driven decision making and continuous process optimization. It is important to monitor routinely as this ensures that bottlenecks are identified and corrected promptly. So let's look at the key performance indicators here. Number one will be the stockout rates. Frequency of critical items being unavailable when needed. It is a key performance. It is something to look out for. What is the rate of the stockouts? Order turnaround time. That is the time from requisition when you make your order to the delivery of the supplies. Okay, is it long? Is it longer than it should be? Is it unnecessarily long? These are things that you should also consider as a key performance indicator. Then another one is expiry rate. What is the percentage of items that expire before use? This will be indicative of poor forecasting or over ordering. Because if more items are being expired before they are used, that means that it is you're over ordering. Because before you can finish the stock you have, they would have expired. Then if the items, poor forecasting is that you're not even forecasting the one that will be enough. Okay, so you're over ordering because there's poor forecasting. Vendor compliance is another one, is another key performance indicator. This measures the performance of the vendor based on delivery time, product quality, and contract adherence. Okay, let's look at internal audit and corrective actions. It is important to do regular audits, and these regular audits must include inventory management and procurement practices. Any non-conformities like delayed deliveries, inconsistent documentation, or poor storage must be logged. Not you don't just end at logging them. It doesn't end at it being logged. Okay, sorry about that. Yes, you don't end at it being logged. You still have to investigate and make corrections. Okay. Audit results should be fed into periodic management review meetings. That is very important too. Okay. Another key consideration is the feedback loops from end users. This is very important. It is an important performance monitoring and continuous improvement strategy. Okay. Clinicians, lab scientists, and quality officers should be encouraged to provide feedback on the adequacy of supply, product reusability, and service responsiveness. This information gotten is very valuable for refining vendor selection. If they are not meeting up, okay, based on the feedback that that is received from the clinicians, lab scientists, and quality officers, then you may need to look for another vendor, or you may need to give them corrective actions to take to improve on their services. Also, information is valuable in procurement schedules, and also inventory management practices. Let's look at this case scenario. A regional laboratory network reports frequent delays in testing due to stockouts of essential reagents. Internal audits reveal inconsistent procurement timelines and poor coordination between central and satellite labs. How can integrating supply management into the lab's QMS help improve the situation? So there is a delay, frequent delay in testing due to stockouts of essential reagents. Then an internal audit is done, and it shows that there's inconsistent procurement timelines because of poor coordination between central and satellite labs. So what's the solution? By integrating supply chain management into the laboratory QMS, several improvements can be introduced. So the lab that is having this challenge, what you have to do is to integrate some principles of supply chain management into its QMS. One of the things you can do is policy standardization, whereby harmonized SOPs will be developed for forecasting, ordering, and inventory tracking across all the sites. Then, staff training. It is important that training of staff is done, especially the focal staff at each location, on a unified inventory platform. That is, if a situation whereby you're using a digital inventory management system. And also, it is important you don't just stop at training them, you reinforce adherence to SOPs. You make sure that they adhere to the SOPs. Another one is performance monitoring. It is important to introduce in this lab as a solution. You have to introduce monthly key performance indicators such as stockout frequency, delivery timelines. Review these metrics at regular quality meetings to know whether there is an improvement, whether you're improving or not. Communication channels. It is important to establish real-time communication and feedback loops between the central procurement units and the satellite labs for proactive issue resolution. And these are the risk management strategies you have to employ. So what are the challenges of inventory management in lower middle income country laboratories? Well, there are many, but these are the few I will mention, and I'm sure that all of us that are in the lower middle income country here can relate with that. Inadequate or outdated inventory tools, that is the manual or non-integrated systems. That is what is common in our environment. Lack of trained personnel for inventory control, unreliable supply chains and erratic delivery schedules, poor forecasting, okay, because it is difficult to forecast efficiently when you are using the traditional paper-based method of inventory, okay, because you're not seeing everything in real time. One example I will give is in the manufacturing, okay, in the manufacturing of blood components. I had the privilege of having a training in blood transfusion at NHS BT, and their inventory system was really very interesting because it interested me to know that I could see everything in real time from the donor. The tracking is from the donor to the patient. You see everything, the stock, how the expired ones, the ones that have issues, how they discarded them, the outcome of the screening of the donated blood and all of that. It's just a seamless thing that you could view in real time. But in our situation, in the low middle income country, when you look at that, we have different separate documents for you have the donor documents, you have the screening documents. So it's difficult when there is need for you to trace an event from the donor, from the recipient to the donor. It will be like something that is very, very almost unattainable. So this is a very, very big challenge, and I know that it can be related to other areas of pathology apart from blood transfusion. Poor forecasting can lead to frequent stockouts or wastage. Limited storage capacity or substandard storage conditions is another challenge. Then weak linkage between inventory and procurement units is also another challenge because they may not be located, they may not be in the same location. Okay, so it's usually a communication problem at times. Now, what are the strategies for strengthening inventory management? One of them is capacity building of labs and logistics personnel on inventory best practices. Another one is implementation of digital inventory systems. Example, the Open LMIS, and the rest of them. Then it is important to also develop standard operating procedures for all inventory activities. So think of all inventory activities, all of them, they need to have an SOP. Another one is regular inventory audits, like I've mentioned, and feedback mechanisms or loop, because these feedback mechanisms and regular audits helps for continuous improvement. It is important to also consider use of mobile inventory apps in remote or decentralized labs. In conclusion, my key takeaways will be robust supply chain, inventory and procurement management is very, very key for laboratory quality, resilience and sustainability. Digital tools, strategic planning, and sustainable procurement must be integrated into QMS for optimal outcomes. Continuous review and improvement will go a long way in supporting laboratory readiness, cost control, and quality service delivery. My final thoughts. An optimized supply chain, inventory, and procurement system is not just a logistical function. It is a cornerstone of laboratory quality and resilience. By proactively managing shortages using the risk-based approach, leveraging digital tools, and adopting sustainable sourcing practices, labs can ensure uninterrupted service, regulatory compliance, and better patient outcomes, even in the face of uncertainty. Thank you. And my apologies for all the interruptions and hitches. So it's a network issue. Thank you very much for your audience. Questions?
All right. Thank you very much, Dr. Eze for the presentation. It was quite interesting despite the occasional hitches from our network. Please, the floor is open for questions or any observations. We do not have so much time. We have less than 5 minutes to entertain any questions. So once anybody has a question to ask, to be very snappy with it. Thank you very much. Okay, we can see from the chat, Dele Mohalu said, thank you so much, Dr. Eze, for the elaborate and interesting presentation. And Abraham Bam says, no questions. Thank you, doctor, for your patience and good delivery. I think I agree with him. Thank you. We want to appreciate you, Dr. Ine, for the patience, having to go over the presentation, stopping halfway for us to correct our technical issues, and then picking up again without being phased or flustered. We appreciate your patience and your composure. Thank you very much. So that will bring us to the end of today's presentation. It's been an interesting topic on optimizing supply chain, inventory, and procurement in laboratory quality management system. You have a link even on the here on the presentation to the course landing page where you can access the videos and the recorded version of this presentation. You can access them, and also you can access the PowerPoint presentation for your own personal review when you want to study or when you want to go through them over again. So the link is always going to be there. It was even there in the invitation for today's seminar. So I'm sure by now or maybe by tomorrow morning, they will all be available for you to download and review. So in the absence of any questions, we would like to thank you for joining us again today. We will have our last session coming up next week. That will be week 12. And the topic will be on leadership, governance, and documentation for effective laboratory quality management system. That will be delivered by Dr. Ojo Emmanuel. And in the course of that, we hope to see how strengthening laboratory leadership and governance will drive quality in laboratory settings. We'll also go to the best practices for regulatory documentation, compliance, and workflow optimization. And then finally, we'll look at strategies to streamline document control and ensure adherence to quality standards. So I'm sure it's going to be an interesting presentation. With that, we come to the end of today's presentation. Thank you all, Loretta Etafo, Ngozi Ubu, and Adum Emmanuel. Thank you very much for your kind words. We appreciate. All right, have a nice day, everybody. We hope to see you next week. Bye.